What are the risks of smoking before plastic surgery? Smoking before plastic surgery can seriously impact your healing process and increase the chance of complications. Nicotine and other chemicals in cigarettes cause blood vessels to constrict, which reduces blood flow and oxygen to tissues. This is critical because tissues need proper blood supply to heal well after surgery. When blood flow is limited, the risk of tissue death, or necrosis, rises significantly. In fact, studies show that tissue necrosis is over 10 times more common in smokers undergoing plastic surgery. Reduced oxygen levels also impair the body's ability to repair wounds, leading to delayed healing and a higher chance of wounds reopening or not healing properly. This can result in longer recovery times and increased discomfort. Smoking also weakens the immune response at the surgical site, making infections more likely. Surgical site infections can cause further complications and may requiring additional treatment or even revision surgery. Another concern is abnormal scarring. Smoking can cause scars to become thick, raised, or darker than usual, which can negatively affect the final appearance. In procedures involving fat transfer or liposuction, smoking increases the risk of fat necrosis, where fat cells die and form from lumps under the skin. This can distort the results and may requiring further intervention. Smoking also raises the risk of blood clots, stroke, and heart attack during or after surgery. These systemic risks are particularly concerning because they can be life-threatening. For reconstructive procedures involving tissue flaps or implants, smoking increases the chance of flap failure or implant complications, which can compromise the surgical outcome. Patients who smoke often experience longer-lasting pain and discomfort after surgery. They may also face longer hospital stays and higher chances of needing readmission. Because of these serious risks, most plastic surgeons strongly recommend quitting smoking at least 6 weeks before and after surgery. Nicotine replacement therapies like patches or gum are generally discouraged during this period because they still contain nicotine, which can constrict blood vessels and impair healing. In summary, smoking before plastic surgery significantly hampers blood flow and oxygen delivery to tissues, leading to higher risks of tissue death, infection, poor wound healing, and abnormal scarring. These complications can threaten both your safety and the aesthetic results of your procedure. Quitting smoking well in advance of your surgery is a vital step to ensure a smoother recovery and the best possible outcome. Always consult your surgeon for personalized advice and support on smoking cessation before your procedure.